I'd like to hear from Maria Whelan, who's the President and CEO of Illinois Action for Children and a grantee partner of the Chicago Foundation for Women. Maria?
Good afternoon. Thanks, everybody. This is a great topic and a very important one. So we know nationally that 37% of low-income single moms work hours that are unusual. Gone are the days when poor women were able to work Monday through Friday, 9 to 5. We know in many, many communities this figure is much higher, with significant majorities of women working service sector jobs and work schedules that are defined by what is called just-in-time scheduling. In Illinois, we have had many center-based pilots to try and figure out if there is a way to serve these families in center-based programming. And what we discover is not really rocket science. It's pretty basic. When you're tired and you just finished mandatory overtime at the big box retailer and you're taking 2 buses to get home, you don't want to stop and pick up a sleeping 3-year-old and transport them home. So we know that for a significant numbers of low-income women, the need for flexible home-based child care options is an absolutely critical one. Next slide, please. So the types of home-based child care that exist for these families, the most flexible, frankly, is what we call family, friend, and neighbor care. In Illinois, family, friend, and neighbor care providers can legally care for 3 or fewer children, including their own, or children from the same family. The majority of these family, friend, and neighbor care providers are related to the children they care for, and we think that that's a good thing because people who are related to children love them, and that's a big element of providing children with a quality experience. These family, friend, and neighbor care providers are able to provide care for very flexible work schedules. And so when you get to work and you find out that mandatory overtime has been scheduled, you don't lose your job for having to go home and pick up a child. Or when you get called the day before your work schedule and you find out that you're not needed that day, you don't have to pay for child care that you do not need. We also, in the home-based arena, there are licensed child care homes. These are typically larger groups of children. In Illinois, up to 16 children can be cared for in what we call licensed child care group homes. Those settings do require additional staff in addition to the primary provider. Next slide, please. So the community connections model that I'm going to be describing really does grow out of the fact that the isolation of many at-risk children in family, friend, and neighbor care extends to limiting access to high-quality early education programs. What we found in Illinois is that despite the expansion of our very rapid expansion of our Preschool for All program, our research has shown that many at-risk children in family, friend, and neighbor care fail to enroll in preschool programs that are available in their community. In addition to our work recruiting children into traditional preschool and Head Start programs, we have also pioneered with both our public and private funding partners develop the community connections model that brings children who are cared for in family, friend, and neighbor care settings to center-based preschool for a portion of their day. They're linking child care and educational access across settings. So I'm going to take just a few minutes to describe the model. I do want to say, though, that this community connections model that I'm going to be describing really does occur within our much broader context of reaching children and families and caregivers in isolated settings. This array of services includes almost 70 field-based staff who work to provide family child care and family, friend, and neighbor caregivers support for our quality rating system, the child and adult care food program, early learning resources, and so on. So this is a program that happens in a larger context. And basically, what we do is in high-need communities, we identify child care centers who are interested in partnering with us, and that's been an interesting process in itself. And the Child Care Center provides classroom space for community connections children. The children are 3, 4, and 5 before 1st-year-old children. They are transported from the home-based setting, either the licensed family child care home or the family friend and neighbor caregiver, to the center 4 days a week for either an AM or a PM preschool session. On the 5th day, the preschool teacher visits the child care provider with books, activities, and other resources. We also use teacher assistants to help in the home visiting program as well. The preschool part of the Community Connections Day is funded through the Illinois State Board of Education, our Preschool for All program, and we are that reimbursement runs between $3,000 and $4,000 depending on the community per child. We also work very, very hard with our Illinois Department of Human Services, our Child Care Bureau, who really got and supported the notion that dinging providers financially, in fact, disincents their participation. And so home-based providers continue to receive a full-day child care or whatever portion of the day child care assistance payments so that they are not impacted in a negative way financially by having the kids attend the preschool classroom. So next slide, please. So the benefits of the Community Connections model, first of all, center classroom activities focus on school readiness. Children are taught by highly qualified, certified teachers, paid either directly by Illinois Action for Children or by the host child care center. When we started out in this work, learning as we went, we found that there were a significant number of child care centers who didn't have the human resource infrastructure or benefit package that was needed to attract fully certified early childhood teachers. And so we have, in fact, 22 teachers right now who are directly on our payroll, and the child care center really does just serve as a host site. I think another, again, learning as we went benefit that we have seen is the impact that hosting a Community Connections preschool program has on the overall program that's offered at the Child Care Center. The program that we offer is, it includes a research-based curriculum, enhanced supplies and equipment, the certified teacher, and what we see in virtually all of the programs with whom we partner, that kind of quality improvement activity sort of bleeds over, if you will, into the rest of the child care center. And they become much more engaged in things like the quality rating system, implementing a curriculum, and so forth. We see that the home-based provider is able to receive new resources, information, consultation, as well as other programs and resources that are provided by Illinois Action for Children and our community-based providers. We have also seen, and again, a lot of this we really know from our home-based providers, that one of the huge benefits that they experience is that while the 3- and 4-year-olds in their care are off at preschool, they are really able to tend to infants and toddlers in a very, very different way, and feel that the quality of care that the babies and toddlers receive is dramatically improved. Next slide, please. So we are in the process of a formal evaluation that is being the first stage, which is a process study examining the implementation, quality, and satisfaction of the Community Connections model is being done by Child Trends and the National Center for Children in Poverty, and we are hopeful that we will be able to begin planning an outcomes evaluation as well. Again, I would stress that this work occurs from a broad context at Illinois Action for Children, and our work to be a catalyst for organizing, developing, and supporting strong families and powerful communities where children matter most. And that's it.
Thank you, Maria.